Thank you all so much for joining today's Public Health Discovery Seminar Series. Again, my name is Cassietta Trewick. I go by Cassie. I'm one of the admission counselors here at the City of Sky Weatherhead School of Public Health and Tropical Medicine. And today I have the honor of introducing Dr. Arachu Castro, who will be presenting her seminar series on the impact of adolescent motherhood, poverty, and child rearing on developmental outcomes in early childhood. At the end, we will be doing a Q&A session, so please feel free to drop your questions in the Q&A chat during the presentation. And again, we will address those at the end. And so take it away, Dr. Castro.
Good afternoon, everyone. Thank you for the invitation to be here today, and thank you for those who are here today also. I'm going to present some of the research that I'm currently conducting and also explaining how a research study can get done. And usually it requires a lot of people. So I'm going to spend some time explaining the what did I do prior to studying the impact of adolescent pregnancy on early childhood development. So I've been working in the Dominican Republic for several years, like more than 16 years. And in about half of those years, I have particularly worked with Dr. Laura Sanchez Vincitore, who's the director of the Neurolab at the Universidad Iberoamericana, so Ibero-American University, or UNIBE. And when we started to collaborate, we both had an interest in studying, in trying to understand the specifics of how poverty affects early childhood development. There's been evidence from all over the world for several decades that poverty is one of the main causes of early childhood delay, and that affects millions of children worldwide, both in high income and in low and middle income countries. We wanted to know what are the specifics, how does it happen in a place like the Dominican Republic? So the first thing we needed is how to measure early childhood development. Most tools to measure ECD, early childhood development, evaluate children in 4 dimensions. Those are gross motor, fine motor, language, and socio-emotional development. So it's not just height and weight, but also these other 4 development measurements, which is what is understood as early childhood development. And there are tools that are used. You may have heard of the Denver tool, and those are widely used. However, they have 2 limitations. They had 2 limitations for the use in the Dominican Republic. One is that it's you have to pay to use it with every child. And then also another limitation is that each development tool needs to be adapted culturally to each context. For example, when you are evaluating the children, you are observing them with playing with specific toys, and it is recommended to use local toys that children can recognize. And or you also ask questions to the main caregiver, and that is usually the mother in most places around the world, and that is the case in the Dominican Republic. So we had to adapt the tool, not just linguistically. We developed it in Spanish, and we've tested it in Spanish. We also have a Creole, Haitian Creole translation that we have yet to use. And what we did is we looked at an instrument, a research tool that we could access for free, and we identified one in Malawi. And we adapted the tool from Malawi to the Dominican Republic. To test the tool, we worked with an MPH student from Tulane, Paul Shettle. He was then doing his MPH at Tulane, and he did an internship in the Dominican Republic with us. And we have a paper that explains the results of that tool. So so we had student involvement, but also we developed this tool that had a huge impact at the national level in the Dominican Republic, because while we were preparing the tool and testing it, we were in touch with policymakers that work on early childhood development, and we were letting them know that we wanted to develop this tool and that if it worked, it would be great if we could use it at a larger scale. So that's what happened. The Dominican government had created, around right before we started this tool, had created the National Institute for Early Comprehensive Care for Early uh, for young children. And it is a program that would be similar to Head Start in the US. And as part of the program, they have daycare centers that are completely publicly subsidized. And they also have other centers that are for families whose children are not in those daycare centers, but who also can benefit from different social services. So this National Institute, which is INAIPI, and you hear it, you can see it in the middle of the screen. INAIPI and UNICEF became very interested in the use of the tool, and it went through a process of internal validation, and it then became the national tool. So now the tool that we developed with very few, with a very low cost, it was about $1,000 to test the tool, is the national tool, and they use it, INAIPI uses it twice a year with the 180,000 children that attend their daycare centers. So that is allowing to identify children who are falling behind, but also is enabling us through our relationship with INAIPI to conduct studies that are going to improve the care that INAIPI provides to their families, and at the same time allow us to make discoveries that contribute to benefit populations. And so first we developed the tool. Second, my colleague Laura and I conducted an analysis, a quantitative analysis of 2 household surveys that are called MIX, and those are administered by UNICEF, and they are available for countries around the world, and they are free to access. You can Google that on the website, on the web, and you will find there's a large amount of countries that have these surveys and that repeat them every few years. So we analyzed the last 2 mixed surveys for the Dominican Republic, and we had some hypotheses we wanted to test. And we found, as expected, but sometimes in research, even if there is knowledge that has been tested in different countries, you still need to test it at the local level, because first, it's good practice to understand if those ideas, that information that happens in other parts, whether it's valid where you're working. And second of all, policymakers really appreciate it when you have local data. And so we analyzed the data sets, and we found that the socioeconomic gradient predicted the ECD outcomes. That is, the wealthier the children or their families, the better ECD scores they had, and the poorer they were, they were at a higher risk of having a developmental delay. The good thing about identifying delays early, I didn't mention early, is that in most cases, you can intervene and redress that issue, and then so that the child can develop as expected according to their age. What we also found in the analysis of the surveys is that if, in addition to studying the income quantile of the family or the education level of the mother, if we added psychosocial measures, we were able to identify that using violent discipline against the child was associated with developmental delay. And on the other hand, having more stimulating activities for the child or bring the child to a daycare center, to an early daycare center, was associated with better developmental scores. We have had a number of publications, but I wanted to highlight another one where another Tulane student participated, which was Katrina Nelson. She did her PhD dissertation research in the Dominican Republic, and she studied 25 women who had children under the age of 5. She conducted a set of qualitative analysis, and she also found that the use of physical punishment was more frequent when the mothers had begun to have children as adolescent. And it's a qualitative study. There cannot be, we cannot use it as conclusive evidence, but it does because it fine tunes the processes by which these mothers, whether they had adverse experiences growing up or whether they received violent punishment growing up, and how, or whether they were in violent intimate partner relationships, that whether that affected the way they brought up their children. So that's another student who benefited from this collaboration in the Dominican Republic. So more recently, we've done a series of studies with the National Institute for Comprehensive Care in NIPE. I obtained a grant from the National Science Foundation 2 years ago to do a study in Santo Domingo with my collaborator from the Neurolab. And Annie Preo, who was then a doctoral student, conducted fieldwork with us, and she wrote her entire dissertation based on the study that we started 2 years ago. 2 years ago, Annie Preo and I interviewed 102 women, and well, Laura Sanchez also interviewed some of those. And we interviewed women who had children ages 2, 3, and 4. And we took life history, so we have a very rich amount of information, the life histories of these women. And we also administered a set of surveys. And we are currently analyzing the data. We are also identifying how different types of family structure are associated with the type of discipline used in each family, particularly by the mother, but also the father, whether they're stimulating the child, whether they're using violence. And now those ideas, that those first sets of analysis from studying the life histories, we are using to inform the analysis of a new set of data that we recently collected with over 1,000 women from Santo Domingo. And we decided to trim down the age of their children to 2 to 3 years, so that we could follow up the children for longer while they're still attending those public daycare centers. Because when they turn 5, they go to public school. And we had lost some of the children, lost to follow up some of the children who turned 5 and that we had studied 2 years ago. So that gives us more time to follow up the children who are 2 and 3. And we haven't yet analyzed the data on early childhood development, but we have found that women who initiated their motherhood as adolescents are more violent against their children. And that is associated with having experienced adverse childhood adverse experiences as children themselves, and also with suffering intimate partner violence, and we having symptoms of depression. But we have also found that certain types of family structure affect the use of violence against children, and also promoting activities that stimulate the child. Finally, we are starting this year the project Ascendi, which is an intervention on nurturing care for adolescent mothers, We are just waiting for the approval from the IRB to get started. And we're going to provide women who live in an area with a high concentration of adolescent pregnancy. We're going to provide a series of 12, we're going to provide 12 sessions once a week for 12 weeks with a clinical psychologist. And it's all evidence-based on evidences promoted by the World Health Organization and UNICEF using the nurturing care framework. And we are going to collect data before the intervention and at the end of the intervention, hoping to find that the intervention help diminish the use of violence against children. In this project, we have a doctoral student, Nora Badri Rodriguez, who is completely involved in this project. And so as you see from just an overview of some of the work in the Dominican Republic, you see that students who come to Tulane, whether at the MPH or PhD level, become involved in many research studies that can have a lot of impact on the ground, while also contributing to generating new knowledge. There are other students who've also worked in the DR, in the Dominican Republic as part of these studies, but those are the ones that have contributed the most. Now I'm going to present some findings from another analysis that Laura Sanchez and I have conducted. And it's a study that we've done using, and you see how I earlier mentioned that we analyzed the mixed surveys from the Dominican Republic. Well, in this new phase, we've analyzed the mixed surveys from 15 countries in Latin America and the Caribbean. The manuscript is currently under peer review, but you can access there's a preprint that is available, and you have the link in the bottom, but also you can scan the QR code and it takes you directly to the preprint if you're interested. In many publications, it's actually very good practice. You need to justify why you did this and what your study contributes to the literature. And for this study, I did a search of studies on early childhood development and adolescent pregnancy. And I read over 300 papers to identify what was new about our study and about our findings. We found that in the last 10 years, there were only 4 studies that had been conducted that examined the association between ECD, early childhood development, and adolescent pregnancy. And those 4 studies had been conducted in a single country each time. So ours was the first study to analyze this association in more than one country. And in our study, we provide evidence that both poverty and child-rearing practices interact in that association between adolescent motherhood and ECD. There's been in the literature over the years a lot of discussion of whether the association between adolescent pregnancy and ECD and early childhood development delay is caused by poverty, because adolescent mothers tend to live in poverty more than women who start their maternity later in their lives. However, poverty although it explains a lot of this association, it doesn't fully explain the entire association, and that is why it's so important to look at what are the caregiving practices, child-rearing practices with the child. And the implications of our study is that our findings underscore the potential benefits of policies that improve educational and employment opportunities for adolescents, and that also policies that help delay the age of motherhood. So some of the policies are increasing access to contraception and sexuality education, but it's in addition to that, youth needs to have opportunities other than motherhood to decide also not to become pregnant, because although some of those pregnancies are were not intended and were unplanned, some of those are looked for, and there's a lot of literature that shows that a portion of those adolescent pregnancies were actually on purpose, and a lot of the most of the explanations for that phenomenon is that in a context of poverty and lack of opportunity, having a child becomes a goal in life and a purpose for some women. The study of adolescent health and adolescent pregnancy in particular has gained global health attention in the 1990s. And it was observed that, well, that's when the debate started to be around the fact that adolescent pregnancy is a complex social phenomenon, and that results from socioeconomic and educational factors, and that has significant consequences for the health of the woman and also for the health of the children. So children of adolescent mothers, there are several studies that show that they are at higher risk of poor health outcomes, such as low birth weight, preterm birth, undernutrition, higher mortality rates, and poor physical and mental health, of having developmental delay, and receiving limited nurturing care, and greater physical assault and psychological aggression from their mothers, and having a lower language development, lower educational attainment, lower life satisfaction, and lower personal income later in life. But the challenges, as I mentioned, is not only because the mother's adolescent or because she's poor, but it's also because she has limited educational opportunities and more exposure to gender-based violence, and also violence while growing up. So I conduct all of my work in Latin America, most of my work in Latin America and the Caribbean, and it's the second highest. Latin America and the Caribbean have the second highest prevalence of adolescent pregnancy globally, after the African continent. But the fertility rate, and some years, because I look at it almost every year, some years it has the highest prevalence. Fertility rate is 266 births per 1,000 women under the age of 20. And that what it means is that 14% of children in Latin America and the Caribbean are born to adolescent mothers, and that's almost 1.5 million children. Most statistics, unfortunately, are not collecting data on women under the age of 15, but there are some reports that show that there are pregnancies starting from the age of 10. And as you can probably imagine, the majority of those pregnancies result from sexual rape and sexual assault. And in many countries, even pregnancies between the age of 15 to 19 are the result of statutory rape or just purely rape. However, that is not necessarily looked into. And most of the blame for adolescent pregnancy falls in the pregnant woman, in the pregnant adolescent. Within the Latin American and Caribbean region, there is a high variation in the percentage of children born to adolescent mothers. We see that in the last few years, Venezuela has had an increase, and there is often an increase in fertility in countries that are going through socioeconomic crisis or war. So fertility increases during war, and Venezuela has a very important socioeconomic crisis with a lot of migration. So these are the countries that we studied. These surveys are collected usually every 5 years in each country that participates in the mix program. And there are different rounds. The current round of surveys, so the surveys that are gonna be published soon are in the 7th round. But for this study, we used the 5th and the 6th round, and these are the countries that we studied. So there's a good representation from Central America, the Caribbean, and South America. In the mixed survey, we use these questions about child discipline and belief in physical punishment. There are questions that in the survey they ask to the woman, to the mother of the children who are in the survey. And for positive discipline or positive child rearing is when the child does something that is not good, what do you do? And so one option is to take away privileges, explain why their behavior is wrong, or give the child something else to do. That's considered positive. However, negative or violent is when the mother shook the children, shouted, yelled, or screamed, spanked, hit, or slapped the child, hit the child in the bottom, called the child dumb, lazy, or another name, hit or slapped the child in the face, head, or ears, or on the hand, arm, or leg, or beats the child up as hard as one could. We have asked those questions. We ask those questions ourselves regularly in all of our studies in the Dominican Republic. And although they show a very harsh situation, we haven't had any problems asking those questions. And a lot of these violent events are frequent. The one that we found was less frequent was to beat the child up as hard as one could. That was the less frequent, and usually in most countries that's the least frequent form of discipline against children. There is also a question in the survey where they ask a mother if they would consider physical punishment as an appropriate strategy to correctly discipline a child. So those are the questions that we analyzed to establish an association between adolescent pregnancy and child rearing practices. We also looked at the early childhood development index from these children. In all, with those 15 countries, the sample size was 26,000 children, which is a large sample size. And of all these children, 20% were born to adolescent mothers. It's a good amount of data to conduct a statistical analysis. So we found and we confirmed that age and sex at birth, well quintile, and maternal education are associated with ECD scores in all countries, although there is some variation between countries. So girls have a higher, well, I have to say that regarding the use of girls and boys, all the data collected in statistics around the world usually identifies sex as sex at birth, so it's female or male. And at these young ages, the terms that are widely used are girl and boy. So girls have higher scores than boys in all countries. This may seem obvious, but 4-year-olds score higher than 3-year-olds, which, what it means is that the instrument is working, because if we found the opposite, it would be suspicious. ECD scores improve as wealth quintiles and maternal education increase, and children born to mothers aged at least 20 have higher ECD scores in all countries compared to those of adolescent mothers. All the tables and statistics are available in the preprint if you are interested. We also found that adolescent mothers live in greater poverty and attain a lower level of education than mothers aged 20 and older. Part of it also is that they have less time to study, but what's relevant, very relevant, is that they live in greater poverty. And we also found that adolescent mothers use more negative or violent discipline, believe more in physically punishing their children, and there was another question, and it's whether they justify partner violence. And it's like under certain conditions, for example, if they burn the meal, or if they go out without permission, whether they would justify that their partner beats them. And we found that mothers who do not believe in physical punishment have children with higher ECD scores, and mothers who do not justify intimate partner violence have children with higher ECD scores. So in conclusion, we found that adolescent mothers use less positive and more negative discipline with their children in several countries: Dominican Republic, Argentina, Costa Rica, Guyana, and Honduras. And adolescent mothers believe more frequently in physically punishing their children and justifying their partner's violence against them. However, their effect sizes were modest. Several studies have shown that adolescent mothers have fewer parenting skills are older women, and also in self-regulating, coping with stress, being more patient with their children, being affectionate and interactive with their children, and stimulating their children, and also in understanding the children's needs, which may lead to less responsive, stimulating, and affectionate care. They may also experience greater distress, anxiety, and depression. And also remember that a lot of these adolescent pregnancies have been caused by rape. And their stress may be heightened in cultures where early marriage and pregnancy are not normative. And as I mentioned earlier, where some scholars have argued that poverty of adolescent mothers is the most important explanatory variable of ECD delay, others have emphasized that parenting practices compounded with pre-existing and ongoing social disadvantage explain this association. And what we found from these 15 countries is that it's a combination of both poverty and violent child rearing that explains the greater ECD delay among children of adolescent mothers. And just to finish, what are the policy implications? Well, it's important when we do research to have a plan for informing policymakers, to have a plan for taking action. So in our case, we're taking action because we are starting this project, this intervention, the project Ascendi, where we're going to work with a group of adolescent mothers for 12 weeks. And by the way, we are hiring 2 women who were adolescent mothers themselves as advisors to the project for the duration of the project. And so it's important to prevent these the fact that children of adolescent mothers have greater risk of ECD delay, to address the socioeconomic context. Because strategies aim at delaying the age of motherhood, they cannot be just limited to sexual education, reproductive health services, and contraceptive methods that are accessible, which are necessary. But in addition to making those services available, policies need to address the socioeconomic context in which adolescent motherhood occurs by improving educational employment opportunities. And because that can mitigate some of the disadvantage, such as unfulfilled educational aspirations or unstable housing that predispose adolescents to start child rearing, and which at the same time intensifies the disadvantage that they already have. So for those for those adolescent mothers that already have children, promoting nurturing parenting practices, such as the Ascendi project that we're about to start, helps provide resources and knowledge to promote nurturing practices and nonviolent family environments for improving the well-being of both the adolescents and their children, and also contributes to reducing inequity gaps in early childhood development outcomes. So that's a presentation. I'm happy to take questions or comments from participants.
All righty. Thank you so much, Dr. Castro, for that Public Health Discovery Seminar series. At this time, if you have any questions, please drop them in the Q&A chat.
Somebody has raised their hand.
Yes. So the question is, I'm wondering what inspired you to look at adolescent mothers? Have you looked at older mothers as well?
Yes, of course. We have compared adolescent mothers with mothers age 20 and older. And when we studied 102 women 2 years ago, and then 1,019 women recently, we have included women of all ages. And we're interested in all of them. However, one of the findings is that we found in the set of data that we are currently analyzing with over 1,000 women that those who began motherhood as adolescents are more violent against their children. So in comparison with those who are older. And what inspired me? Well, finding that when we were conducting the life histories 2 years ago of 102 women, we spent about 2 or 3 hours with each of them, asking a bunch of questions and understanding how these women are very strong and live in very difficult circumstances and do their best for their children. And yet they use harsh discipline methods against their children, whom they love. I mean, I had no doubt that the great majority of these children, of these women, love their children. But I started to notice by conducting the life histories that there were some differences with those that had started motherhood earlier. And that's what led me to become interested. I'm always interested in working with populations that are the most disadvantaged. And even in this sample, even if the entire population that we study live in disadvantage and poverty and harsh circumstances, those that are adolescents or who started who became pregnant earlier live usually in even worse difficult conditions.
Another comment was, that's interesting. I was more so thinking about parents aged 40 to 50 years old. Next question, what made you look at the Caribbean/Latin America for the sample population?
Well, the data sets, the mixed surveys are available for many countries around the world. But even if you're looking at statistical numbers, you need to be able to guide your statistical analysis by conceptual frameworks and hypotheses. And I have a better understanding of Latin America and the Caribbean because I have worked in the region for over 25 years in different countries. And I could frame those questions better than if I worked in other settings where I have less experience. So my interest in Latin America comes from many years ago. And I started to work in the region in the 90s, in the late 1990s, when soon after I first visited. I didn't mention this, I'm originally from Spain. So Spanish is my first language. And I've also learned Portuguese to be able to read the extensive literature in public health that is published in Brazil. And I have done some field work there as well. Other questions?
Did you take into account the relationship between adolescents' mothers and the fathers when collecting your data? In
Yes,
Africa, a child's behavior is often influenced by the current relationship status of their parents.
yes, that's a great question. We have. Um, in the sample that we recently collected of over 1,000 women, we have questions about the father. And well, we also have the information from the previous sample. But what we have found is that the presence, the cohabitation of the mother and the child with the biological father is associated with greater stimulation activities for the child and less violent discipline. And we're also looking at the age gap between the mothers and the biological fathers, and looking at who else lives in the household, or whether the woman lives by herself with her children. So we're looking at very different types of family structures, but definitely we're paying a lot of attention to the biological father.
We have another question, and it has a intro into the question. That was actually very interesting. I am mad that I postponed starting. Also, I was an adolescent mother, and I can attest that I may have been more physical with them than my youngest. I was born in Chile, but raised here. I think it was just the norm of my own upbringing, but you have my own gears turning, and I can't wait to read more on that. My question is, do you use students in the classroom to expand on this if they are interested in it, or do we all come in with our own research study that is approved before we are accepted?
Well, thank you for sharing your experience. Well, it depends if you come to do an MPH or if you are a PhD student. If you are an MPH student, you are required to do an internship. And it is great if available to do this internship abroad, because particularly if you're interested in international health. Otherwise, there are plenty of opportunities to do the internship in New Orleans or in Louisiana. And it depends on your relationship with your professors, or whether the professors need research assistants. And if you're a PhD student, it's different, because the first 2 years you're taking courses, and you start to work with faculty on research projects. And that also trains you to then undertake your own research project. And to do that, you need the support from the faculty, and particularly your doctoral advisor and doctoral committee. But you then get to develop your own research questions, unless you're part of a larger project, and then you contribute to that project, but doing some independent work. So it's a little different whether you're a master's or a doctoral student. I hope I answered your question. Otherwise, when you said postpone, I hope that means you're coming.
Are there any more questions?
Okay, no more questions. Well, I hope you found this information interesting. I particularly want to stress that one of the greater advantages of coming to Tulane is that students get to work on projects that could have significant impact on the ground, and both here in New Orleans and abroad.
Okay, thank you all so much for joining today's Public Health Discovery Seminar Series. Thank you so much, Dr. Castro, for presenting. Please stay tuned for our next Public Health Discovery Seminar Series. And take care. Thank you all so much. Oh, wait, we got one more Q&A. Oh, thank you, Dr. Castro and Cassie. You're so welcome. Y'all have a wonderful day.